A really common comment that I hear is my quad feels like it's still asleep, or my quad just isn't working. It hasn't woken up yet. Do you know what I can do to help it wake up or help it, work faster, things like that? If you have experienced this before, or you maybe thought that before, I'm going to give you some tips in this video to help get the quad to wake up, and I'll also cover information about what that means. So for those of you who don't know me, my name is Dr. Samantha Smith. I am a physical therapist that specializes in knee replacement. So all my social media is dedicated to knee replacement recovery. My YouTube here, if you haven't subscribed, please do. Also my TikTok, my Instagram, and I have a Facebook support group as well for knee replacement recovery. So please go find me, follow along for lots of educational information, exercises. I have everything. I also have a website. So my website is succeedcourses.com. I teach courses, I teach exercise classes. I have a ton of information on my website for you. If you feel like you are behind with your knee replacement recovery, or you feel like you're not progressing as you should, or you feel like your knee isn't bending, I have stuff to help you on my website. Just go to succeedcourses.com. Everything is right there on the front page. Okay, let's get into the topic of this video. The quad waking up. What is going on? Why is it still asleep? What can we do to help it? So the reason why the quad is kind of turned off after surgery is definitely from the nerve block. So that is kind of the first thing my mind goes to. When they do the surgery, after they give you a nerve block to help with pain control. So this is very important, but it also gives you a lot of weakness in that quad muscle specifically. So the nerve block goes into the quad nerve. So the nerve that goes to the quad is going to cause a lot of pain. So they do what's called a block to block the pain signal to the knee and to the muscle. So after surgery, you will not have a ton of pain because this nerve block is still working, but you will also have a ton of weakness, specifically in the quad muscle. So you will know you have weakness because you won't be able to lift your leg into bed. You won't be able to kick your leg out in front of you. You may not be able to stand on that leg right away and the knee buckles on you. Those are symptoms of that nerve block really causing that quad weakness. Some of you who do have the nerve block don't have those symptoms though, so it's kind of interesting. Some people have them and some people don't. Another reason why the quad isn't working or it's asleep is because they do cut into the quad muscle during the surgery to help move that muscle out of the way to get to the knee joint so they can replace your knee. So they don't detach the quad or anything like that. They just make a small incision so they can move it out of the way. That small incision does cause a lot of quad weakness. So that may be another reason why you're experiencing quad weakness. Another reason is a tourniquet. Some surgeons do use a tourniquet around the upper thigh to control blood loss. So this is important for, blood loss during surgery. It's also important for the surgeon so they can see what they're doing. If there's blood everywhere during the surgery, they can't replace your knee because there's stuff in the way, obviously. So that tourniquet does damage the quad muscle, and it causes decreased oxygen to the quad muscle. So that is going to cause a lot of quad weakness after surgery. So that's another reason why the quad is still asleep or it's not working. The last reason would be just pain and swelling in the knee. When your knee is swollen, the quad is it doesn't work as well. It's called quad inhibition. So that can cause, a lot of quad weakness. The pain also, when your knee is hurting, you don't want to use the knee. You don't want to extend that foot out in front of you and use the quad muscle. That is an indication of quad weakness as well. So there's a variety of reasons why your quad may not be working, or you feel like the quad is still asleep. So what can we do to wake up the quad, and some exercises to kind of test if it is really the quad that is the problem. So generally the quad is awake. It's getting the signal. The brain and the muscle are connected, but it's just not working, as the other one does. So your non-surgical leg, you may see a big difference in the two. But I guarantee you, if you're in physical therapy, you're doing quad exercises, you're working that quad muscle, and you may not even know it. So I'm going to show you those exercises now. So some exercises that you may be doing in physical therapy that are working the quad muscle are your just standing marches. So let's say this is my surgical leg, just doing a standing march. We are working the quad muscle when doing a march. It's not solely quad contraction to do a march. You do have to use some hip flexors to do a march, but we are working that quad. Another one you may be doing is mini squat. So if you are bending down and doing a squat, coming back to standing, this is working a lot of quad. So you probably are doing quad activation, but you feel like maybe the quad is weak. So that would be a better term to use instead of saying my quad is not awake, my quad is turned off. Instead, your quad is just weak, and that weakness is completely normal. An exercise that is really challenging after surgery, and I usually don't give this exercise for, at least 7 to 10 days, because it's just the quad is weak and it's painful and it's hard to do this exercise. But it's such a simple exercise for me to do. I haven't had a knee replacement, just your sitting kicks. This is a quad isolating workout or exercise. When you do a kick out in front of you, it's called knee extension, or we call it long arc quad in PT language. So this exercise solely works the quad muscle. You're working all 4 quads with this exercise. So if you can't do this right after surgery, that's okay. It's just because that quad is weak, and it's also because the quad is damaged from the incision, from the tourniquet. Maybe that nerve block is still kind of causing some irritation. You have pain and swelling in the knee. This one doesn't feel very good. So if you can't do that exercise, that's okay. Another one is you may notice that you can't lift your leg into bed without assistance, without a strap around your foot. Maybe somebody has to help you. So if you cannot do this to get into bed, that is an indication that the quad is weak. So we call this a straight leg raise when you bring your leg up into bed. The reason why it's so difficult is because the leg is very long, and when we have a long leg, so the taller you are, it's probably going to be more challenging to get the leg into bed. So what we have you do instead is, use your hands for assistance, or just bend your knee and try to lift up and get into the bed. That shortens the lever that we have to use. So the longer the lever, the more challenging it's going to be for your muscles to lift that leg into bed. But that's just quad weakness. I wouldn't be concerned about that at all if you can't lift your leg into bed. It just comes with time. Another one that you may not be able to do is straight leg raise. So again, this kind of like the same one, getting that leg into bed. Doing a straight leg raise is really challenging after knee replacements because of the quad weakness. So your quad isn't necessarily turned off or not working because you can't do a straight leg raise. You may have to do it with the knee bent and do it like this because that quad is weak, and it's damaged from the tourniquet, from the incision, like we said. So one exercise that you can do just laying down are called quad sets. So you just squeeze that quad muscle and push that knee down towards the floor. So you might notice that the quad on the surgical leg contracts a little bit slower than your non-surgical leg. You may notice that you don't get that lifting of the foot because that quad isn't working or is weak instead. Let's use that term instead. So there is kind of different exercises that you can do to activate the quad, but it may not feel like you're activating it as much as the other one. But I guarantee you, if you're in physical therapy, you're doing some sort of quad exercises. Generally, the exercises we're having you do is, maybe contracting the quad secondarily. It's not a quad isolating exercise. I tend to move into quad isolating exercises around the second phase of knee replacement recovery, just because the quad is so painful and it's just not worth it to try to strengthen a damaged and painful muscle because of that surgery. So hopefully that answered a lot of questions. Your quad probably is awake. It's probably working. It just may not be working as the other one is. So it's just weak from the surgery. Totally normal. Again, please check out my website, succeedcourses.com. I have a ton of stuff on there for you guys, a lot of courses, exercise classes. Thank you for watching. I'll see you again next time.